Hi guys, good day. So are you a physiotherapist? If you're a physiotherapist and you are looking for questionnaires for Philippine exams and PTE and Middle East, well, you are in the right video. So for today, we will give you 200 most common questions that can be seen in these three examinations, possible examinations. So part one, we have 20 questions. Let's start. Question number one. A physical therapist is performing an evaluation on a patient that has fallen off a forklift and injured his right arm. The patient was evaluated by a medical doctor 3 days ago. The patient reports, yesterday my arm started to go numb and turned purple. A poor arterial pulse is found in the arm upon evaluation. Which step should the physical therapist take first? A. Notify the MD of the changes immediately. B. Begin light exercise program per MD orders. C. Apply E-stim and ice to the extremity. D. Special test the right arm. And the answer is A. Notify the medical doctor of the changes immediately. Let's go to the next question. Question number 2. A physical therapist is reviewing a patient's medication during an evaluation. Which of the following medication would be contraindicated if the patient were pregnant? A. Coumadin. B. Celebrex. C. Catapres. D. Habitrol. And the answer is letter A, Coumadin. Let's go to the next question. Question number 3. A physical therapist is reviewing a patient's past medical history. The history indicates photosensitive reactions to medications. Which of the following drugs has not been associated with photosensitive reactions? A. Nitroder. B. Sulfonamide. C. Noroxin. D. Bactrim. And the answer is Nitrodor. Let's go to the next question. Question number 4. A patient has a diabetic ulcer on his right foot first ray region. The ulcer is in a chronic state of tissue inflammation and the patient is extremely obese. The wound is not infected at this time. However, the patient is unable to ambulate at this time without applying pressure to the first ray region. Which of the following interventions would be the most beneficial to the patient? A. Whirlpool 10 minutes followed by a sharp debridement. B. Have the patient fitted to offload pressures on the first ray in a week. C. Review the role of glucose and tissue healing with the patient. Or D. Have the patient perform non-weight bearing gait with auxiliary crutches with the extremity. And the answer is letter C. Review the role of glucose and tissue healing with the patient. Let's go to the next question. Question number 5. A 35-year-old male has been an insulin-dependent diabetic for 5 years and now is unable to urinate. Which of the following would you most likely suspect? A. Atherosclerosis. B. Diabetic nephropathy. C. Autonomic neuropathy. Or D. Somatic neuropathy. And the answer is The answer is letter C, autonomic neuropathy. Let's go to the next question. Question number 6. You are taking the history of a 14-year-old girl who has a BMI of 18. The girl reports inability to eat, induced vomiting, and severe constipation. Which of the following would you most likely suspect? A. Multiple sclerosis. B. Anorexia nervosa. C. Bulimia. Or D. Systemic sclerosis. And the answer is B. Anorexia nervosa. Let's go to the next question. Question number 7. A patient has a right T8 facet joint that has become extremely tight. Which of the following movements would stretch the joint with the best technique? A. Left trunk rotation and extension. B. Left trunk rotation and flexion. C. Right trunk rotation and extension. Or D. Right trunk rotation and flexion. And the answer is B. Left trunk rotation and flexion. Let's go to the next question. Question number 8. A 50-year-old blind and deaf patient has been assigned to you for evaluation. As the lead physical therapist, your primary responsibility for this patient is A. Let others know about the patient's deficits. B. Communicate with your supervisor your concerns about the patient's deficits. C. Continuously update the patient on the social environment. Or D. Provide a secure environment for the patient. And the answer is D. Provide a secure environment for the patient. Let's go to the next question. Question number 9. Your patient is getting discharged from SNF facility. The patient has a history of severe COPD and PVD. The patient is primarily concerned about their ability to breathe easily. Which of the following would be the best instruction for this patient? A. Deep breathing techniques to increase oxygen levels. B. Cough regularly and deeply to clear airway passages. C. Cough following bronchodilator utilization. Or D. Decrease carbon dioxide levels by increased oxygen take output during meals. And the answer is C. Cough following bronchodilator utilization. Let's go to the next question. Question number 10. Which of the following is the best exercise to correct a Trendelenburg gait pattern? A. Bridging. B. Bridging with resisted abduction. C. Bridging with straight leg raise. Or D. Squats. And the answer is B. Bridging with resisted abduction. Let's go to the next question. Question number 11. A physical therapist is caring for an infant that has recently been diagnosed with a congenital heart defect. Which of the following clinical signs would most likely be present? A. Slow pulse rate. B. Weight gain. C. Decreased systolic pressure. D. Irregular WBC lab values. And the answer is B, weight gain. Let's go to the next question. Question number 12. A mother has recently been informed that her child has Down syndrome. You will be evaluating the patient in the afternoon. Which of the following characteristics is not associated with Down syndrome? A. Simian crease. B. Brachycephaly. C. Oily skin. Or D. Hypotonicity. And the answer is C. Oily skin. Let's go to the next question. Question number 13. A patient asks a physical therapist, "My doctor recommended I increase my intake of folic acid. What type of food contains folic acids?" A. Green vegetables and liver. B. Yellow vegetables and red meat. C. Carrots. Or D. Milk. And the answer is A. Green vegetables and liver. Let's go to the next question. Question number 14. A patient has developed trochanteric bursitis that has gone untreated for 5 weeks. The patient is 34 years old. Which of the following ultrasound settings is most appropriate? A. Pulsed US at 3 MHz. B. Pulsed US at 1 MHz. C. Continuous US at 3 MHz. Or D. Continuous US at 1 MHz. And the answer is D. Continuous US at 1 MHz. Let's go to the next question. Question number 15. A child is 5 years old and has been recently admitted into the hospital. According to Erickson, which of the following stages is the child in? A. Trust versus mistrust. B. Initiative versus guilt. C. Autonomy versus shame. Or D. Intimacy versus isolation. And the answer is B. Initiative versus guilt. Let's go to the next question. Question number 16. When you are taking a patient's history, she tells you she has been depressed and is dealing with an anxiety disorder. Which of the following medications would the patient most likely be taking? A. Elavil. B. Calcitonin. C. Pergolide. Or D. Verapamil. And the answer is A. Elavil. Let's go to the next question. Question number 17. A patient's chart indicates a history of hyperkalemia. Which of the following would you not expect to see with this patient if this condition were acute? A. Decreased HR. B. Paresthesias. C. Muscle weakness of the extremities. Or D. Migraines. And the answer is D. Migraines. Let's go to the next question. Question number 18. A patient's chart indicates a history of meningitis. Which of the following would you not expect to see with this patient if this condition were acute? A. Increased appetite. B. Vomiting. C. Fever. Or D. Poor tolerance of light. And the answer is letter A, increased appetite. Let's go to the next question. Question number 19. A fragile 87-year-old female has recently been admitted to the hospital with increased confusion and falls over the last 2 weeks. She is also noted to have a mild left hemiparesis. Which of the following tests is most likely to be performed? A. FBC. B. ECG. C. Thyroid function tests. Or D. CT scan. And the answer is letter D, CT scan. Let's go to the next question. Question number 20. A physical therapist is evaluating an adult that has recently been diagnosed with hypokalemia. Which of the following clinical signs would most likely not be present? A. Leg cramps. B. Respiratory distress. C. Confusion. Or D. Flaccid paralysis. And the answer is letter D. Flaccid paralysis. Thank you so much for watching the part 1 of our 200 most common questions.